is Bianca Martinez, and I'm going to be doing our medication check for Coumadin for week 7. I'm going to begin by pulling up the patient in the MAR. The patient is going to be Linda Blocher, date of birth 9/4/1972, and she's here with the diagnosis of atrial fibrillation. She has no known allergies, and her provider, Dr. Who, has ordered Coumadin 5 milligrams PO daily for her atrial fibrillation. Now that we've verified the patient and the medication order, we're going to go ahead and walk over to our Texas. Coumadin was ordered in an oral form, so once we grab the pill, we are going to check the date to make sure it is not expired. The date is 10/20/37, meaning the medication is still good to give. We are going to go ahead and do our second medication check. It is going to be for Linda Blocher, date of birth 9/4/1972, here with the diagnosis of atrial fibrillation. She has no known drug allergies, and Dr. Who ordered Coumadin at 5 milligrams PO daily for her atrial fibrillation. Now that we did our second medication check and have the medication ready, we are going to go ahead and walk over to our patient's room. We are going to begin by knocking on the door, closing the curtain for privacy, hand hygiene. We are going to introduce ourselves to the patient. Hi Linda, my name is Bianca. I'm going to be your nurse today, and I'm here to give you your Coumadin medication that was ordered by Dr. Who. Do you have any questions about the medication? Have you taken it before? If they haven't, just let them know what the medication is. The Coumadin is an anticoagulant, and it's going to help the prevention of blood clots from forming, since your heart is kind of working a little faster, so it's kind of in a way trickling. So I would show them like with my hands how the heart is beating a little quicker. So the Coumadin is going to help prevent new blood clots from forming. Before we actually enter the patient's room, you do want to check their PT-INR levels before giving them the medication. Now I'm going to be doing, now that I explained the medication to the patient, I'm going to be doing my third medication check by having the patient state their name and date of birth while looking at the name band as well. Do you mind repeating your name and date of birth for me, Linda? Linda Belcher, date of birth 9/4/1972. Do you have any drug allergies? No allergies, okay. And her name and date of birth match the name band, what she stated, and repeat it to me. While also checking that we have the right medication for Miss Linda Blocher, date of birth 9/4/1972, and Dr. Who ordered her Coumadin at 5 milligrams PO daily. Do you have any issues swallowing, Linda? No? Would you mind taking a sip of water for me? Once I see that the patient has no problem swallowing, I'm going to go ahead and administer the Coumadin to the patient. I'm going to be giving Linda Blocher her Coumadin at 5 milligrams that was ordered by Dr. Who. Give her some water so she can swallow the medication. I'm going to dispose of the trash into the garbage bin. Hand hygiene. Okay, Linda, I'm just going to give you some side effects to watch out for. Coumadin is known to cause bleeding, so we're going to be monitoring your IV site or anywhere you might have been poked at with a needle. We do recommend you using an electric razor and a soft toothbrush. That way we prevent the bleeding in your gums. And we would also recommend you avoid eating so many leafy vegetables because they contain vitamin K, which is actually the antidote to Coumadin. And once you leave the hospital, it is likely that you're going to be following up with blood draws. That way we can see, the doctor will see if they need to check your Coumadin level, increasing it or decreasing it depending on how your levels are. Do you have any questions? Once the patient doesn't have any questions, I'm going to go ahead and hand hygiene again. I'm going to be giving you the call, Linda, and if you need any questions, please don't hesitate to ask. Before leaving the room, we are going to document that Miss Linda Blocher, date of birth 9/4/1972, here with the diagnosis of atrial fibrillation. She has no known drug allergies, and she was given her Coumadin 5 milligrams PO that Doctor Who has ordered for her.